Hello there, I'm Dr. Lambroussis, board-certified family medicine physician and the Assistant Director of Osteopathic Principles and Practices at the LECOM Elmira campus. And today I have a special guest, Miss Samantha Lavertue, fourth-year medical student. I'll let her introduce herself.
Hi, my name is Samantha. I started at LECOM. I'm part of our inaugural class. I'm class president. Came here from the lovely state of New Hampshire, and this is my last year at LECOM.
Congratulations.
Thank you.
So why did you choose LECOM?
Well, when I was applying to medical school, I knew that I wanted a DO program. And if you're from New England and have been searching DO programs, you know that there are not that many. So I searched all around and found that Elmira was going to be LECOM's newest campus. So I specifically applied here through the process because it was close to my family. I wanted to be as close to New England as I could get. And it seemed like a really good fit for me at the time. LECOM has excellent match rates, good programming, and they have a special PBL program, which I thought I would enjoy. Elmira is a great campus. We have a lot going for us. It's in New York. None of our other campuses are in New York, so it's a new place. And because we got to start here as the inaugural class, we got to build everything. So all of our volunteer opportunities, the community was so excited to have us come here, and they were constantly reaching out, and they still constantly reach out. I get calls saying, hey, can we get students to come help us with this? And it will be with the Veterans Association, or it will be, with the Early Opportunity Program here in Elmira. And so we've established routes that I find are somewhat uncommon when you're looking at medical schools in regards to the programs and communities here that need us, that want us to be here, and we've had a great opportunity to really settle in and start helping a community that really needs it.
Excellent. Yeah, I heard the match rate is 100% from last year, so hopefully
It is.
we keep those numbers up in the coming year.
Fingers crossed.
So you did mention PBL, and the Elmira campus is strictly PBL. So from a student perspective, can you tell us a little bit about PBL and how you view it at LECOM?
Yeah, so LECOM does PBL. If you've been researching medical schools and you looked around, you might have heard the term TBL tossed around. Essentially, team-based learning, problem-based learning is the whole goal. Essentially, your classes are small, so max 9 students, I believe, in a room about 2 hours a day. You get a case, a chief complaint. Patient comes in with shortness of breath, and then your job as the team is to take the patient encounter from start to finish. So from the chief complaint to a diagnosis and a treatment plan, ideally in some cases with some follow-up information. And your job is to be the doctor, be consultants, figure out what's going on with this patient, and learn about body systems, anatomy, physiology, disease process as you take a case from start to finish. It's a great way to do practical learning. It shortens your time in the classroom and allows you to spend a lot more time outside of the classroom directing your own learning to where it really needs to go. Everyone as a group chooses what they're going to be learning about, usually based on a body system, and that's also what you're tested on. And those things cement your knowledge of different body systems and allows you to incorporate knowledge together in groups that allow you to remember it better when you move on, essentially.
Excellent. So I know you're graduating in the very near future, almost done. So how would you say first and second year PBL compared to what you've seen on clinicals over the past year?
Yeah, I've worked with a lot of really great students from other schools, MD schools, DO schools, but I tend to be unique in that I'm the only one who's done PBL when I'm rotating around, unless I'm rotating with other LECOM Elmira students. And I would say the biggest difference is our ability to think clinically from day one. A lot of students spend time doing blocks of classes. They do all of anatomy, and then they do all of physiology, and then they study renal, and then they study pulmonology. And by the time they get to their clinicals, maybe the last time they were studying the lungs was second semester of their first year of medical school, where with our process, we kind of review things a lot, and you're always thinking clinically. You understand flows. Every time you go to the hospital, the residents, the doctors, what do they care about? They care about patient flow. We have a lot of patients to see in a short period of time, and students who can think clinically can be a lot more helpful and tend to stand out on their clinical rotations. I've heard that comment a lot from my own preceptors, just that, oh, you knew what labs to draw, you knew what we were expecting to see throughout the course of this patient's visit, you were very helpful to us, and that's a big thing, and it looks good when you get letters of recommendation based on those comments.
Pretty sure I probably might have been one of the physicians that even commented about that for PBL back in the day, because what I've personally seen is exactly what you've said as well. You see the new third-year students after they've done the first 2 years, and essentially when they're on rotations, the first several months, they clearly stand out because they're already used to doing PBL.
Absolutely.
The major difference being, instead of a computer screen, it's an actual patient behind door number one. Mm-hmm. So, yeah. I do have the question that's next. So, as the fourth year, you're in the midst of applying to residencies as we speak, correct? Mm-hmm. So, how would you say LECOM has prepared you for life post-graduation?
LECOM has a lot going for it. I think they place a really strong emphasis on career counseling, and not just when you start to hit your second year. It's literally from day one. Dr. Terry's PowerPoint I think is even titled Career Counseling at LECOM Elmira. And on orientation day, they sort of take you through, here's what you're looking at over the next 4 years. And there's some stuff that you don't have to worry about right away, but we want you to be aware that it's coming up. And so the constant focus on, you're here for medical school, but we're looking to place you in a residency. That's what we want. That's why our match rates are so high. We prepare our students well, and we get them a match. So they focus a lot on career counseling. They have a lot of affiliates, strong programs that are associated. So we send students to Buffalo, New York, to Rochester, New York. We have some downstate programs, some more upstate programs. We have programs in Pennsylvania and all these other states that allow us to sort of spread out, send students, let them get associated with the programs that they're interested in, and then see how they do in the match. So I rotated here at Arnett, which is Elmira's closest campus, and things have gone very well. They have residents, so I have learned how to be in a program that has a residency. Sometimes in medical school, med schools will have affiliate hospitals, but those hospitals won't have any residency programs, and you're going and you're shadowing with a physician who is great but hasn't been in a residency program in 15 years, and things change a lot in a short period of time in medicine. So being here where there are residency programs, you learn how to function with the resident team, and that looks really good when it comes time for interviews and applications.
Outstanding. Which residency are you considering?
I'm dual applying this year. I'm applying for orthopedic surgery and pediatrics. Ideally, even in orthopedic surgery, I'd be working with the pediatric population eventually, but LECOM is preparing me very well for those. We have board help. We have a physician who does that, and that was very helpful for sort of achieving those board scores that we want to see when we're applying for competitive specialties. Every specialty pretty much is competitive, so you need help across the board no matter what. But I'm excited to see how it goes.
So as a fourth year, soon to graduate, what advice can you offer the current students and the soon-to-be students, the incoming students, on how to avoid burnout in medical school?
I think you should rely heavily on routines. Know what you need to be a happy, functioning person and rely on those things. I go to the gym every day. I rely on that to sort of get me going in the morning. Having a healthy group of friends that knows how to both study and how to have fun. There's so many great things just in this region. You've got Watkins Glen, you've got Ithaca, there's so many places to explore, so if you plan your time well, you're able to do that. And with our PBL program, you get a ton of work-life balance because we're in class 2 hours a day, Monday, Wednesday, Friday, and then a little bit longer on Tuesdays and Thursdays for our more hands-on practical learning classes where we study osteopathic manipulative medicine and history and physical taking. So that allows you a lot of time in the day. If you're someone who can get up and say, I'm going to study from 6 a.m. to 2 p.m., and if I hit everything on my list, then I'm going to go do something fun this afternoon, you can do that without being worried that you're really messing up any kind of schedules because you've stuck to a routine. And I find that routines are what save you when you're studying in PBL. They save you when you're going through your clinical rotations because you need to be places more so, and you need to be ready to go every morning at rounds when they happen at 6:30, 7 o'clock in the morning, and then, still come home and study at night. So setting yourself up on a schedule really helps you know what your day is going to look like to some extent. You may not know what patients are walking through the door, but at least you know what you're going to do about it. And then it kind of helps you relax at night and allows you to turn off everything at night and say, okay, I'm here, I've hit all the things on my list, so I don't need to stay up until 3 o'clock in the morning to study. I've done all the things for today. Now it's time to relax, spend time with your partner, cook a nice dinner, sit in front of the TV for a few minutes. You have time to do those things here, and I think that has really helped me stay focused and less burned out.